Part, I think, could have been improved on. We did our implementation in 4 days, and then on Monday through Thursday we had a trainer, and then on Friday we were on our own. They had expected us actually to have no patients at all for that whole 4 days, which was impossible. So I kind of bucked the trainer, and we just had a very abbreviated schedule, and some doctors saw full loads and the other doctors saw just a couple patients to train, and we kind of took turns being trained. Our practice could not afford a cash flow dip with no patients for a whole week, and plus we don't have anybody else to cover the patients, so we needed to see our patients. And so for us, we were kind of combining a couple of things, and so it was very quick and fairly cursory, although we got most of the things we needed to know. The rest, we did teach ourselves a lot along the way and after that. And then the follow-up was not the greatest. It was difficult sometimes to reach our trainer, even though we had a period of time when we could reach her. They were helpful when we could get a hold of them, but we couldn't get a hold of them on a moment's notice. And in that particular time, which was a couple of years ago, the practice part of tech support was just getting ramped up to be as good and efficient as it is today. So we would wait several days to get a call back, from a problem. We were kind of floating on our rafts for a while, but we didn't drown, and we made it. But I think if I had something to change, I would make it possibly a little bit slower. I would probably do maybe 1 week for the front desk, and then the second week the doctors come on. I still think it's very important to bring the whole thing up fairly quickly. It integrates so well, and so much of everything is dependent on other parts of the EHR that I would tend to bring it up quickly, but that it could, maybe a 2-week process would have been better, and then having someone more local that we could call on when we had problems or trouble along the way.
Would it have made a difference if you had somebody that came out and did a follow-up after 2 weeks, 3 weeks, whenever?
It would have made a tremendous difference for us if we could have had somebody come to the office once a week, once every 2 weeks, to spend even an hour with us, to ask how are we going, what are the problems, we could save them up. We tried to be very self-sufficient if we could, but there were certain things that we just didn't know or weren't covered in the training, and couldn't find them on the help desk, and so we just needed to ask somebody who had experience, and it would have been very, very nice to have something to count on, so that we could say, oh, so-and-so is going to be here next week, so we'll just save this up and then we'll get that solved then.